Hi, I'm Dr. Greg Homer, the inventor of laser eye color change and the founder of Stroma Medical Corporation. I'd like to discuss our technology with you, how it works, and why it's safe. Understanding how our technology works requires an understanding of two basic principles of eye color. The first principle is that under every brown iris is a blue or green iris. In all eyes, other than albinistic eyes, the entire posterior chamber, including the posterior iris, are coated with a thick layer of pigment, typically 3 to 4 cells deep. This layer extends to the posterior iris and forms what is known as the iris pigment epithelium, or IPE. In brown irises, however, the anterior iris is covered by a thin brown layer of pigment, typically only 1 cell deep. The second principle of eye color is that there is no blue or green in a blue or green iris. The iris is actually composed of gray collagen fibers called the iris stroma. These gray fibers appear against the black background created by the densely pigmented IPE. When visible light enters the iris, the stroma fibers scatter the light into its component wavelengths: blue, green, yellow, orange, and red. The longer wavelengths, which are the red, orange, yellow, and possibly green colors, are absorbed into the IPE. The shorter wavelengths, which are the blue and possibly green colors, are bent and backscattered back out the front of the iris. This creates the blue or green appearance of the iris. Our device uses an Nd:YAG green laser to move a small, low-energy laser spot about the surface of a brown iris. Our procedure is non-ablative. Instead, our device simply raises the temperature of the pigment and then allows it to cool. The laser is applied multiple times in rapid succession, causing the pigment temperature to rise and fall several times. The total treatment time is less than 1 minute per eye. This repeated raising and lowering of the temperature of the stromal pigment recruits macrophages to the iris surface. Macrophages are the body's natural debris scavengers. The cells are dispatched from the iris vasculature to the iris surface. Eventually, the macrophages cover the entire anterior surface of the iris and begin digesting the pigment cells. The macrophages then remove the digested pigment through the iris vasculature, whereupon it is eliminated, removed through the body's natural circulatory waste system. As a result, the pigment is never released into the anterior chamber and never passes through the trabecular meshwork or the Schlemm's canal, so no risk of pigmentary dispersion or pigmentary glaucoma is implicated by our procedure. It takes about 3 weeks for all of the stromal pigment to be digested away, at which point a natural blue or green iris is revealed. Of course, as with any aesthetic procedure, management of patient expectations is key, and in order to do so effectively, the patient must be able to predict outcomes preoperatively or adjust outcomes postoperatively. Fortunately, we can do both. Color is defined by 3 sub-properties: hue, saturation, and value. The hue of a color represents its shade, for example, blue, brown, or green. The saturation of a color represents its proximity to white. Sky blue, for example, is less saturated than navy blue. Finally, the value of a color represents its reflectance of light. In the context of eye color, therefore, the value of an eye color is inversely proportional to its saturation, because the closer a color is to white, the more light it reflects. We've developed a technology that predicts the underlying hue of the patient's iris based on a number of anatomical factors. The technology then generates a headshot image of the patient with the predicted hue of his or her iris. The saturation of an iris color lies on a continuum with very light gray-blue or green at one end of the continuum and a deep blue or green at the other. Our initial treatment delivers an outcome at the gray end of that continuum. The outcome, in other words, is low saturation with high value. This is the outcome most people want. It's striking because it reflects a lot of light. Also, in many regions, such as Asia and the Middle East, The only natural light eyes occur at the gray end of the spectrum, so a deeply saturated eye looks unnatural to these patients in these regions. The reason the initial treatment outcome lies at the gray end of the continuum is that in those patients with brown eyes, a small number of pigment cells remain below the anterior surface of the iris. These pigment granules absorb a portion of the backscattered hue, revealing less hue and more of the gray of the stroma fibers. The result is a bright gray-blue iris with low color saturation and high color value. Once all of the treated pigment has been digested from the iris, our device can be tuned to a longer wavelength which is able to access these deeper pigment cells within the iris stroma. By eliminating these deeper pigment cells, more of the backscattered light passes through the front of the iris, so more of the iris hue and less of the gray stroma fibers are visible. The result is a deep blue iris with deep color saturation and low color value. Our only preoperative medications are 2 Tylenol at 30 minutes pre-op as a prophylactic against ciliary body headache, a topical anesthetic at 30 minutes and 10 minutes pre-op, pilocarpine at 15, 10, and 5 minutes pre-op, and a topical antibiotic immediately post-op. No other postoperative medications are required. No steroid is used because there is no inflammation of the iris or any other ocular tissue. Because our technology is used to achieve an aesthetic outcome, it's important that the device itself make a statement that your practice now includes ophthalmic aesthetics. Thank you for watching this presentation. We look forward to providing you with further updates as our technology evolves and grows.